My name is Dr. Jess Costa-Pinto and I'm a paediatrician. I work on the ward at Box Hill Hospital, and the nurse unit manager Leanne and I a few years ago were talking about the appearance of the ward when children entered. Very white, looked a little bit sterile, which is scary for kids when they come onto the ward. We feel very strongly that the experience that they have with us is so important, because what we're doing is we're shaping the way that they see the healthcare system. We're building trust from an early age so that they're comfortable going to the doctor or presenting to hospital when they're unwell, even long into adulthood. So when we met Tess and heard her ideas for the mural art, we were really excited about this project.
I am Tess and I am an artist. It's one of those projects, I think, as an artist you grow up thinking one day I might be able to do that. When it came up as an idea, leaped at it. I was like, got to. Mum had done a mural at our primary school, and kind of feels nice that it sort of runs in the family that I've had Mum working alongside me as well. It's felt like special. Our three characters are Wilbur, the rock, as well as his two kookaburra friends, Jane and Jasper. They go to Uluru and the Daintree and all the cool places around Australia.
I'm Simon Wheelton. I'm a director of the Rotary Club of Box Hill Burwood and also Wheelton Philanthropy. Our club for many years has supported projects at Box Hill Hospital. This is our standalone project and something we're very proud of to be involved with and to provide and to make this environment in the children's ward just so different from the generic walls in the rest of the hospital. As soon as any of the kids come in here, they'll be blown away just by how different it is. A non-threatening atmosphere where they just can feel totally relaxed.
We know that art has a big impact on the way kids perceive pain, the anxiety that they're feeling. It improves mood, not just for the kids on the ward, but for the staff as well. It's had a huge impact already. I know that for me, every day that I'm at work doing my ward rounds, I use the artwork at least once to get the kids out of their room and engaged in the ward. There are some situations where, for example, a child might not have been walking during their admission and we need them to be mobilising before they can get home. And encouraging them to get up to walk around and look at the artwork has been really helpful for kids like that. Assessing how well they can walk, their ability to get up and whether they're distractible. So the benefits have been very much appreciated already.
At the time, you know, Australiana sort of themes were really big, and I guess I was sort of thinking alongside that it'd be cool to sort of take kids out of the space that they're in and to somewhere else. So that's why you've got Uluru and you've got the Great Barrier Reef and Mount Kosciuszko. I also thought it'd be a great learning opportunity, teach them about, you know, the cool places around Australia and where they could one day go. I've had a number of people, kids on the ward, offer suggestions for what could be added to the work. One asked to have himself at the top of Mount Kosciuszko planting a flag, which I thought was great, and I definitely did that right away.
Everybody gets a buzz out of what's here. It distracts them from the hard yards that they have to do in the medical area, just lifts their spirits a bit, and then that transforms down to the kids as well. And then it's not just all about pain and suffering here in the children's ward. It's about healing, it's about therapy, it's about lifting your spirits, and you lift the spirits and then you can heal better, and it can be a better, more holistic healing that goes on.
I think my favourite part is the little wombat that lives under the mountain with his little fire and his books and the bookworms. I think the kids really love that. They love counting the books and taking a photo, warming their hands by the fire, and yeah, I think that's probably my favourite part.
Mr. Wombat, he was the first character I added, and I think I just was like, yeah, I can do this once I did him.
I think this area that's just near me here, which is the underwater one, is particularly, I love the blues, as you can tell, I'm a blue person.
For anyone who is thinking of making a donation to the Eastern Health Foundation, I would encourage you to really think about it. We put a lot of thought into the things that we need to improve the care and experience for our kids. When we do receive donations, a lot of thought goes into how they can be best used, and we really are grateful for all of the support that we receive from our local community.